My name is Dr. Muhammad Nuh, consultant embryologist, anatomist, and histologist. Today, we're going to talk about the adrenal gland. See, right adrenal gland and left adrenal gland. Take a look to the kidneys. Take a look to the inferior vena cava to your left side, and the aorta to your right side. Supra is called suprarenal gland. It's located above the kidney. As you can see, it forms of cortex, which is outside the cortex, outside, and medulla, which is inside. Take a look to the pictures. You see the zones. See the capsule. The cortex has 3 zones: zone glomerulosa, fasciculata, and reticularis. Take a look to the 3 zones. This is a histology of the 3 zones, how the cells are formed and how the cells appear. The suprarenal glands or adrenal glands, structurally and functionally, there are 2 glands in one, located anterior superior to the upper part of each kidney. They lie within their own compartment of the renal fascia. They lie within the compartment of the renal fascia. The right one is pyramidal in shape or triangular in shape, surmount the upper pole of the right kidney. That is to say, above the upper pole of the right kidney. The posterior relation, the diaphragm, is posterior, located posteriorly. The anterior relation in front of the adrenal gland, inferior vena cava, bare area of the liver, and the peritoneum of the hepatorenal pouch below. The left suprarenal gland is crescentic in shape. It drags over the medial border of the left kidney, above the hilum. The hilum is the region for the entrance and exit of structure. Anterior relation, stomach, peritoneum of the omental bursa. What is the omental bursa? It is lesser sac behind the stomach. It's called omental bursa. It is the lesser sac. As you have seen in the GI tract, the anterior relation is tail of pancreas and splenic vessels. Posterior relation, left calcium diaphragm. And what about the blood supply? Blood supply, we mean arterial supply and venous drainage. 3 arteries, 3 sources, directly from the abdominal aorta, branch from the renal artery, and 2 or 3 branches from the inferior phrenic artery. By the way, the inferior phrenic artery, the branch from the abdominal aorta, is the first branch. When it pierces the diaphragm, the first branch, the abdominal aorta, gives inferior phrenic artery. Vein is drained by a single vein. The right vein is very short and enters the inferior vena cava because the inferior vena cava is located to the right. That to say, the right vein is short. The left vein is longer and enters the left renal vein. Lymphatic to the para-aortic nodes. This is very important. Nerve supply, preganglionic sympathetic fiber from the splanchnic nerve via the celiac plexus. Where is located? Celiac plexus around the celiac trunk. Celiac trunk, the second artery from the abdominal aorta. It gives 3 branches. It gives hepatic artery, left gastric artery, and splenic artery. This once again to revise. The fibers synapse directly with the medullary cells. Blood vessels receive postganglionic sympathetic supply. Cortical control is not neural. It is by the ACTH from the anterior pituitary gland. The development, we have to talk in a logical progression of the development. First of all, formation of the adrenal cortex. First, the cortex appear, and next, the medulla, and development of zones of adrenal medulla. Development of the adrenal cortex is associated with the urogenital system in that these glands develop within the intermediate mesoderm. The cortex developed before the medulla. As far as they know, the urinary system developed before the genital system as well. The rapidly forming cortexes develop from the ceromic epithelium. They appear in the 6th week on each side of the aorta. And the cortex appears 3 distinct cellular zones: glomerulosa, fasciculata, and reticularis. What about the development of the medulla? The medulla from the neural crest. What is neural crest? This is very important to know about the neural crest. We mentioned in other occasions. Take a look to neural tube. Closure of the neural tube begins at the end of week 3, completed week 4. Folic acid is important for this step. What is step for closure of the neural tube? Take a look to the neural tube and surface ectoderm, and between them the neural crest. What are the neural crests? These are cells, ectodermal cells detached from the neural tube, located between the surface ectoderm and neural tube. Take a look once again, have a look at neural crest forming the peripheral nervous system and medulla. Notochord. This is a notochord. And this is mesoderm, 3-part, paraxial mesoderm, intermediate mesoderm, and lateral mesoderm. Here you can see the somites coming from the paraxial mesoderm, somite. Formation of the medulla. Few days after the adrenal cortex forms, neural crest cells migrate into the center of this aggregate to develop into the center region called the medulla. The cells differentiate into sympathetic nerve cells, which become completely encapsulated later in fetal life. By the 10th week of fetal life, the adrenal glands show evidence of catecholamines production. Catecholamines are epinephrine and norepinephrine, or adrenaline and noradrenaline. The cortex engulfs the medulla until the medulla is completely encapsulated throughout the remaining fetal period. 2 cortical layers surround the gland in fetal life: zona glomerulosa and zona fasciculata. But what about zona reticularis, formed after birth at about 3rd year? During fetal life, 2 layers, zona glomerulosa and zona fasciculata. But postnatally appear zona reticularis. The fetal glands are relatively large. At 4 months, they are larger than the fetal kidney. The cortex synthesizes and releases steroid hormones. This is a very important function called corticosteroids hormones. Different corticosteroid hormones are produced in each of the 3 layers or 3 zones. Zona glomerulosa, 50% of the cortical thickness, produce mineralocorticoids, chiefly aldosterone. What is the function of aldosterone? Control homeostasis of water, electrolytes. It consists of darkly staining cells, clumps, aggregation, small rounded cells, as it appears in the histology, as you have seen in later slides. Zona fasciculata constitute most of the cortical thickness. You may have a question. The most zones that form the cortex, you should say that zona fasciculata, most of the cortical thickness, consists of parallel straight course of cells secrete glucocorticoids, chiefly cortisol and cortisone and corticosterone. These zona fasciculata secrete glucocorticoids, chiefly cortisol, cortisone, and corticosterone. They are concerned with normal metabolism and management of stress reaction. The diverticulitis constitute about 20% of the cortical thickness. It is a network of smaller and darker staining cells, smaller and darker, as you can see in the slides of the histology. Secrete gonadocorticoids, chiefly androgens and estrogens. The medulla, made up of chromaffin cells that secrete adrenaline 80% and noradrenaline 20% and some dopamine. Secretion of this hormone causes, what are the effects of secretion of this hormone? What are these hormones? The adrenaline and noradrenaline. It causes blood glucose level to rise, blood vessels to constrict, the heart to beat faster, blood to be diverted to the brain, heart, and skeletal muscles. Adrenaline is a more potent, effective stimulator of the heart and metabolic activities. Noradrenaline is more influential on the peripheral constrictions and blood pressure. Take a look to the stress and the adrenal gland. Take a look at the pituitary gland and the hypothalamus. And here, take a look to the left side. This is a spinal cord. This is a section of the spinal cord. See the medulla, adrenal medulla. See the stress, short term of stress response, increased heart rate, increased blood pressure. Liver converts glycogen to glucose, dilatation of bronchioles, change in blood flow patterns, increased metabolic rate. Here, as long-term stress response, take a look here to corticotropin-releasing hormone from the pituitary, from the hypothalamus to the pituitary, corticotropic cells of the anterior pituitary to target in blood, here, adrenal cortex, as you can see, mineralocorticoids and glucocorticoids. As you can see, long-term stress response, as you can see in here, in this slide. Retention of sodium and water by kidneys, increased blood volume and blood pressure. These are by mineralocorticoids, and by glucocorticoids, proteins and fat converted to glucose or broken down for energy, increased blood sugar, and suppression of immune system. Okay, that's all what I get to tell you. Thank you.